Welcome. Today we will discuss a very common non-communicable illness from public awareness point of view, that is hypertension. Hypertension is the #1 risk factor for death globally, affecting more than 1 billion people. It accounts for about half of all heart disease and stroke-related deaths worldwide. Hypertension is often referred to as the silent killer. Hypertension affects your whole body, whether it's your central nervous system, cardiovascular system, your renal system, your skeletal system, and pretty much about anything. Lowering your blood pressure is associated with decreased risks of heart disease, stroke, and kidney disease. Hypertension is defined as persistent elevation of blood pressure more than or equal to 140 by 90 millimeters of mercury. There is direct relation between hypertension and cardiac disease. In this table, you can see the diagnostic standards for blood pressure ranges as per guidelines of World Health Organization. Hypertension is a very common problem in the modern era. It is expected that about 1.5 billion adults will have hypertension by year 2025, with adults in developing countries like Pakistan contributing most to this number. Here are the results of a survey conducted in Pakistan in 2022. Hypertension may cause headache, dizziness, shortness of breath, nausea, vomiting, nosebleeds. It may remain silent until a major complication has developed. Many risk factors for high blood pressure have been identified. Here are some modifiable and non-modifiable risk factors for high blood pressure. Age, genetics, sex, and race are non-modifiable. But what you can modify is your eating habits, smoking, exercise, and salt intake. High salt diet, physical inactivity, smoking, alcohol intake. These are all the factors you can control. Hypertension can cause many problems. High blood pressure can lead to complications like stroke, renal failure, heart attack, and hypertensive retinopathy. There are many ways to prevent hypertension. You can prevent hypertension by healthy diet plan including vegetables, legumes, whole grains, protein-rich foods, and switching to healthy cooking oil. Here is a research study showing benefits of dietary approaches to hypertension. Physical activity, exercise, and cardio for at least 30 minutes a day has been shown to significantly reduce the risk of hypertension. Smoking is a major risk factor for hypertension and cardiovascular disease, along with other multitude of diseases and problems. Quitting smoking and tobacco intake can be a key to healthy lifestyle. Regular checkup is a key to monitor your health and defend against the deadly outcomes. To summarize, quitting smoking, reducing salt intake, limiting alcohol, doing exercise, and eating healthy and non-processed diet is the least one can do for hypertension. Here are all the levels of prevention with public health point of view. Thank you.